morning, everybody.
Good morning.
I'm Dr. Chakra Rao, the chairman of the Indian Resuscitation Council. We have assembled here to teach you the basic cardiopulmonary life support on Indian guidelines. So, basic cardiopulmonary life support means when there is a sudden cardiac arrest, which is more frequently occurring outside the hospital, then what we have to do, that we wanted to teach you and make you to learn. So the sudden cardiac arrest occurs about 4,280 people per 1 lakh population per year around India. So this is a very high figure. That means about 112 people are succumbed to cardiac arrest every minute. So here, these people are getting the cardiac arrest mostly outside the hospital, at home. So we wanted to teach you, of course, you are all medical personnel working in the hospital. If we are working in the hospital, the cardiac arrest may occur at any time in the hospital premises or even in the ward. If it is work done in the hospital premises, we have to differentiate, act very briskly and calling for the help and looking for the safety of the scene. So these are all the things which we wanted to learn. Now I will share a video.
IRC has come up with 3 guidelines. One, the compression on the life support, COLS, which is primarily for the layperson. The second guideline, which we are going to discuss today, is the basic cardiopulmonary life support, which is for trained paramedics and panics outside the hospital. And the third guideline is comprehensive cardiopulmonary life support, CCLS, which is for management of a cardiac arrest victim inside the hospital by trained personnel. Now, these guidelines are color-coded and each guideline has been discussed separately into different sections. Today, we are going to discuss about the basic cardiopulmonary life support, BCLS, which is primarily for managing a victim of cardiac arrest outside the hospital, wherein the management is being done by trained personnel. Now, these guidelines are available in our PubMed Index Journal, which is Indian Journal of Anesthesia, in November issue of 2017. All the details with regard to these guidelines are available on this manuscript. They are fully downloadable from the November issue of 2017 of Indian Journal of Anesthesia. Now, when we talk of resuscitation of any cardiac arrested victims, we have to focus on some core principles. And for an optimal outcome of CPR outside the hospital would depend upon certain focused links that needs to be followed during CPR. And when we talk of the BCLS, there are 4 essential code links that needs to be followed. Now, these code links, we'll discuss them one by one. They are color coded and we have to follow them so that the outcome of the patient becomes much better. The first link is early recognition and activation. Now, we all know that recognizing a patient of cardiac arrest victim at the earliest is paramount, because if the CPR is not started as soon as possible, then the chances of survival becomes less. Not only this, we need some help. We need some help for shifting the patient from periphery, from outside the hospital to a dedicated medical services. And that's why we need to activate the emergency services so that we can come at the place where the victim has arrested and carry on. Step is the early high quality CPR. Now it is the CPR which is provided with all parameters as according to norms, which we are going to discuss later. And they need to be started at the earliest, because the delay happens for starting CPR, the outcome becomes less optimistic. We know that any patient, usually the adult cardiac patients, usually the cause is underlying some cardiac arrhythmias, and the treatment of choice is defibrillation. The earlier we do a defibrillation, better would be the outcome. And that's why we should be providing all these cardiac arrested victims, especially the adult victims, the early defibrillation. And finally, we have to shift the patient to nearest medical facility so that they can be managed subsequently there. Now, this could be the scenario that can happen outside the hospital. You observe a person who suddenly collapsed in front of you, or somebody is already collapsed when you saw him or for the first time, or you have arrived at a scene where some lay person is providing CPR. He is using COLS algorithm to provide cardiopulmonary resuscitation for that particular patient. But since you are trained personnel, now you have to shift from COLS to BCLS for the management of resuscitation for these patients. Now, the links that we have just discussed has to be translated into a stepwise approach. Now, this algorithm of BCLS provides us a stepwise structured management of a cardiac arrested victims. Let's see them one by one. Namaskar. Today we are going to discuss about the cardiopulmonary. Now, these guidelines are discussed today is the basic cardiopulmonary life support, which is for trained paramedics and panics outside the hospital. And the third guideline is comprehensive cardiopulmonary life support, CCLS, which is for management of a cardiac arrest victim inside the hospital by trained personnel. Now, these guidelines are color coded, and each guideline has been discussed separately into different sections. Today, we are going to discuss about the basic cardiopulmonary life support, BCLS, which is primarily for managing a victim of cardiac arrest outside the hospital, wherein the management is being done by trained personnel. Now, these guidelines are available in our PubMed Index Journal, which is Indian Journal of Anesthesia, in November issue of 2017. All the details with regard to these guidelines are available on this manuscript. They are freely downloadable from the November issue of 2017 of Indian Journal of Anesthesia. Now, when we talk of resuscitation of any cardiac arrested victims, we have to focus on some core principles. And for an optimal outcome of CPR outside the hospital would depend upon certain focused links that needs to be followed during CPR. And when we talk of the BCLS, there are 4 essential code links that needs to be followed. Now, these code links, we'll discuss them one by one. They are color coded, and we have to follow them so that the outcome of the patient becomes much better. The first link is early recognition and activation. Now, we all know that recognizing a patient of cardiac arrest victim at the earliest is paramount, because if the CPR is not started as soon as possible, then the chances of survival becomes less.
Yeah,
Not only this, we need some help. We need some help
I-
for shifting the patient from periphery, from outside the hospital to a dedicated medical services. And that's why we need to activate the emergency medical services so that they can come at the place where the victim has arrested, and they can carry on CPR subsequently further on and shift the patient to the hospital. The second step is the early high quality CPR. Now, it is the CPR which is provided with all parameters as according to norms, which we are going to discuss later, and they need to be started at the earliest, because the delay happens for starting CPR, the outcome becomes less optimistic. The third step is, the third core link is early defibrillation. We know that any patient, usually the adult cardiac patients, usually the cause is underlying some cardiac arrhythmias, and the treatment of choice is defibrillation. The earlier we do a defibrillation, better would be the outcome. And that's why we should be providing all these cardiac arrested victims, especially the adult victims, the early defibrillation. And finally, we have to shift the patient to nearest medical facility so that they can be managed subsequently there. Now, this could be the scenario that can happen outside the hospital. You observe a person who suddenly collapsed in front of you, or somebody is already collapsed when you saw him or for the first time, or you have arrived at a scene where some lay person is providing CPR. He is using COLS algorithm to provide cardiopulmonary resuscitation for that particular patient. But since you are trained personnel, now you have to shift from COLS to BCLS for the management of resuscitation for these patients. Now, the links that we have just discussed has to be translated into a stepwise approach. Now, this algorithm of BCLS provides us a stepwise structured management of a cardiac arrested victims. Let's see them one by one.
So core links means the optimal outcome of the CPR outside the hospital would depend on the certain focused links that are needed to be followed in CPR. There are 4 essential core links here in the basic cardiopulmonary life support. Here, of course, he has all told early recognition, high quality CPR, early defibrillation, and early transfer of the victim to the nearest medical facility. So we'll talk about the early recognition. So early recognition. So
Today I will be discussing about the cardiopulmonary resuscitation for a patient of cardiac arrest. We all have heard about sudden cardiac arrest happening outside the hospital at variable times. Now these patients require immediate resuscitation. So you can check for the pulse as well as breathing, but both the things should be done very much delayed. Sudden cardiac arrest happening out. Today I will be discussing about the cardiac.
Yes, sir. Not going on. Can you see and hear this video?
Yes, sir, we can.
Okay. Now this is the video.
Cardiopulmonary resuscitation for a patient of cardiac arrest. We all have heard about sudden cardiac arrest happening outside the hospital at variable times. Now these patients require immediate resuscitation to improve the outcome. If the resuscitation is delayed, the chances of outcome or chances of survival are very much delayed. Now these guidelines have been published into that the abnormal rhythms becomes normal. So earlier, the earliest we do it, the better would be the outcome. This list that we have just discussed. So we'll go them one by one, that how can we go stepwise approach via this algorithm. Now the first step is ensure this safe place. Now there could be a situation that the victim is lying near the river, or the patient is near the burning house, or maybe inside the house, or the victim gets in cardiac arrest at the site of a trauma or an injury or an accident, or he is near the live electrical wires. So in this situation, it would not be safe for you to go to that scene and start CPR, because that can harm you also. In this situation, ensure look around, the scene is safe, there is no imminent danger or threat to you or the victim. In case if you find there is some danger or threat, ensure the patient is shifted to a safe place. You can take help from many people. You can take help from the police personnel, you can take help from the fire brigade, you can take from the lifeguard, or you can ask the bystanders to help you so that the patient can be shifted to a safe place, and then you can start CPR. Once you have checked for the scene safety, the next step would be checking for the response. Now, when we check on the response, come from the front side, as you can see in the picture, come from the front side, tap on shoulder firmly and ask loudly. So this means we are using tactile and verbal response from the patient by tapping and speaking loudly, hello, are you all right? Speak in a language which patient can understand. And when you are tapping and speaking loudly, look for the response. And this response could be either a verbal response, or it could be a purposeful movement by the patient that he is okay, he is fine. Now, based on this check response, you can have two options. One, the patient is responsive. The other, patient is not responsive. In case patient is responsive, this means patient may be having a transient loss of consciousness. He may be having some underlying disease. So give him a comfort, observe him, and you can shift them, change the position, something called a recovery position, which we'll show a little later. And try to shift the patient to nearest medical facility so that he can be examined and look for what was the reason for his consciousness, and he's become responsive, and they will be able to manage him. In case patient is not responsive, he has not responded to your verbal or tactile stimulus, in those situations, you need some help. So shout for help, right? If there is some near bystander, ask them to call the emergency medical number. If there is nobody nearby or nobody is taking a lead to call for help as asked by you, in those situations, you can use your mobile. Everybody of us have a mobile nowadays. So you can dial the number. The 108 is possibly the national emergency number that will be taken care of. But in some states, there are different numbers. So remember your emergency number, medical emergency number, call them, keep it on a speakerphone, and give them the information about the victim, about the accident or the patient who has suddenly collapsed. Whenever you call somebody, ensure that there are certain things that must be communicated to them effectively. Identify yourself, that who you are. You're a trained person, so they can guide you further on. Identify your location, because you are asking for help. The ambulance has to reach to you. So identify your location as far as possible, more accurately, so that the ambulance can reach you at a faster time. Tell about the victim condition. How many number of victims? Because if there are more than one number of victims, you need more ambulances, you need more help. So tell the number of victims, tell the approximate age or the gender of the patient. And in case patient was complaining something before the collapse happens, as sometimes patient may say that he was having a chest pain and then suddenly collapses, then this communication also needs to be done when you're calling for emergency, so that they can have an idea that what actually the problem could be with the patient. Do not hang on the phone without confirming from them that they have listened to it and they are sending some help to you. So assure before you hang up that everything has been heard and the help is being rendered to you at the earliest. Once you have called for help, or somebody has called for help to the medical emergency number, and they have asked them to bring the AED or defibrillator and the equipments, the next step would be, by the time they are reaching, check for breathing while palpating the carotid pulse. Now, this thing is important. Now, since you are a trained personnel, so you can check for the pulse as well as breathing, but both the things should be done simultaneously. It should be done within 5 to 10 seconds. Now you can check for the pulse. The pulse that needs to be checked would be the carotid pulse. You locate the thyroid prominence and trachea using 2 fingers, as you can see in this picture. Slide into groove between trachea and the neck muscles on the same side and palpate it for 5 to 10 seconds. Now, seeing the time may not be feasible at that moment of time, so you can speak louder. 1001, 1002, 1003, 1004. Till 1010, because chanting 1001 takes approximately 1 second. So you are not delaying the start of further step. And remember, when you are checking for the carotid pulse simultaneously, as you are seeing in this figure, your eyes should be looking on the chest and you can look for whether there is normal breathing or not. So simultaneously scan chest and abdomen for the breathing movements while you are checking for the carotid pulse. Now, when you're checking for the breathing and pulse, 3 situations can happen. One is the patient has normal breathing with definited carotid pulse. In this situation, probably patient has some transient loss of consciousness for some reason, and now he has recovered. Now place the patient in a recovery position, but yes, something has happened, that event can happen again. So reassess every 2 minutes. You have already called for help, and as soon as the help reaches, you shift the patient to the nearest medical facility. The second situation could be the patient is having abnormal or no breathing. Abnormal breathing means patient may having a jerky movements. It is not smooth one, but there is presence of definite carotid pulse. Now I'm using the word here, definite carotid pulse. That is important. If you are in doubt that whether the carotid pulse is absent or present, assume that the carotid pulse is not there. So until unless you are sure that it's a definite carotid pulse, assume this patient to be having a cardiac arrest. Assume this patient to be having a just respiratory arrest. So in this situation, you provide 1 breath every 5 seconds. The breath can be provided by a mouth to mouth using a barrier device, or mouth to mask, or bag and mask. Whatever the availability of equipments are there at that point of time, you can give the breath to this patient. But 1 breath should be given every 5 seconds. The endpoint of breath should be a visible chest rise. It should not be a large tidal volume breath. It should be a normal tidal volume breath for these patients, and that needs to be repeated every 5 seconds. In case if a patient, if you assess after 2 minutes, in case if patient has return of breathing efforts, then we go to the step 1 again, wherein we said that the patient needs to be positioned into a recovery position and shift them to the nearest medical facility as soon as the ambulance arrives to you. The third situation would be wherein patient is having abnormal or no breathing without a definite carotid pulse. This means no breathing, no pulse. So now this situation mandates to start cycles of 30 chest compressions and 2 breaths. Now you have to start 5 cycles of 30 chest compressions and 2 breaths. Now these 30 chest compressions and 2 breaths, they are in cycles. This means you will do 30 chest compressions followed by 2 breaths, followed by 30 chest compression, followed by 2 breaths. So this will be cycles of 30 chest compression and 2 breaths. Let's see how to do an effective chest compression. For effective chest compression, you have to identify the correct rescuer position, identify the site where the chest compression needs to be done. You have to place your hands appropriately and then initiate the process of chest compression. Let's see one by one all these steps. But remember, for effective chest compression, you have to shift the victim to a hard surface. If it's not on a hard surface, if it is on a soft surface or a mattress, try to shift the patient to a harder surface so that effective chest compression can be given to these patients. The rescuer position can be on either side of the patient, right or left, it doesn't matter. You kneel beside the victim and your waist of the rescuer should be above the patient so that you can provide good chest compression. Then you have to identify the site where you have to start the chest compression. So identify the lower end of the chest gyphoid process, which is also called as breastbone. Keep your 2 fingers as is shown in this figure just above the gyphoid process, and keep heel of one hand above these 2 fingers. So this is the location for placing your heel of the hand for initiating the chest compression. So once you have identified the location, keep heel of one hand above the xiphoid process and keep the other hand over the first one like this. Now you have to interlock your fingers so that you can provide them an effective chest compression. Just to revise it once more, once you have identified a victim which requires chest compression and breath, you identify the lowest end of the xiphoid process, keep two fingers there, keep the heel of other hand above the two fingers and keep the other hand over the first one, interlock the fingers and then start your chest compression. Remember, before starting chest compression, your elbows, shoulder and wrist should be in the straight line as you can see in this picture. So it has to be in the straight line so that effective chest compression can be given to these fingers. Fingers should be interlocked. The chest compression depth should be 5 to 6 centimeter, at least 5, but not more than 6 centimeter. This should be the chest compression. And the speed of the chest compression should be 120 times per minute. So this means effectively it will be 2 chest compressions every second. Remember, there should be a complete chest recoil between compressions without lifting hand from the chest. You have to compress it for 5 to 6 centimeter, but release it also, recoil it also, and you should not be lifting your hand from the chest while you are doing chest compression. Do not stop compressions unnecessarily. And as I mentioned earlier, you have to maintain a speed of 120 times per minute. Remember, you can speak louder, 1, 2, 3, 4, 5, 6 to 30, so that you can maintain the timings as well. Since the chest compression can lead to respiratory fatigue, if there are some more persons surrounding you who are trained for it, you can interchange them every 5 cycles. Now coming to 2 breaths. Now these 2 breaths, we have to do 2 aspects of it for giving an effective breath. One is maintenance of the patent airway, because if the airway is open, then only we can deliver the breath to lungs, and then the breath delivery. Now maintenance of patent airway, that is keeping the airway open, it can be done by 2 techniques. One is head tilt and jaw lift, and the second is jaw thrust. Let's see both of them. Now, usually this will be applicable for most of the patients who are not having any suspicions of the cervical spine injury. In this, as you can see in this figure, you have to keep your 2 fingers below the chin and the other hand over the head, and you do a head tilt and chin lift so that the tongue is lifted away from the oral cavity and the airway remains opened up. In case of suspected cervical spine fracture, for example, if a patient has fallen into the diving while diving into the swimming pool or has an accident in which there is suspicion of the cervical spine injury, in those situations, do not do a head tilt because that can exacerbate the cervical spine fracture and can cause neurological damage. In those situations, just do jaw thrust as you can see in this picture, and simultaneously try to provide manual spinal motion restriction, so that there is no motion, no mobility at the cervical spine. Once you have maintained the patent airway by using these techniques, you have to deliver the breath. Now this breath can be delivered by 3 techniques: mouth to mouth, mouth to mask, or bag and mask. For mouth to mouth, you can use any of the shield devices or the barrier devices. They are commercially available, you can use them. They are of various types, so whatever are available, you can use them. If you, even though you don't have them, you can prepare roughly from whatever materials are available, and you can use them as a barrier device so that there is no transmission of infections across the victim and the rescuer. Now you can provide the breath using mouth to mask, as you can see in this picture. Now this is a foldable pocket mask, and as you're seeing this picture, it has a one-way wall. And using this pocket mask, you can deliver the breath to a patient using mask for delivering breath in case of a cardiopulmonary arrest. The third option could be using a bag and mask ventilation using a device, which is this bag and mask device. So this device can also be used if it is available in the ambulance, or if they are available in certain medical kits available at some specific places, you can use this bag and mask device also for ventilating the patients. Remember that you have to give 2 breaths. Each breath should be over 1 second, and you have to pause for another 1 second after the first breath for expiration to happen. Second breath again over 1 second, but do not pause after the second breath. Immediately start chest compression. Do not interrupt chest compressions unnecessarily, remember, for any reasons. And the end point for this breath should be a visible chest rise. So you are looking towards the chest. So if there is a visible chest rise, that should be the end point. And if you are giving mouth to mouth or mouth to mask, the normal tidal volume of the rescuer is sufficient for giving breath to the victim. Now remember, this is the sequence that will happen. Give one breath over 1 second, and again I said 1 second, you can chant 1001, release the bag and chant 1002, give second breath over 1 second, chant 1003, and release the bag, and simultaneously don't wait, start the chest compression. So after 5 cycles of 30 chest compression and 2 breaths, you have to look for the carotid pulse. Again, as I mentioned earlier, the carotid pulse needs to be looked for 5 to 10 seconds, and you should not be taking more than 10 seconds for the checking pulse. Now, two situations can happen at this point. Either the pulse is present or the pulse is absent. In case the pulse is present, we can go back to the second limb where we said that definitely carotid pulse is present, but the breathing is absent. So you can check for the breathing also, and you can provide one breath every 5 seconds and reassess. In case the breathing is also present, then you can place the patient in recovery position. In situations where pulse is absent, you have to restart 5 cycles of 30 chest compressions and 2 breaths. Now this cycle will continue till you get some help, because you have already called for help and you have already asked them to bring the AED and the emergency equipments. So till they come, you continue these 5 cycles of 30 chest compression and 2 breaths and check the pulse every after 5 cycles and take decision accordingly. Once this AED or defibrillator is available, in that situation, you have to use AED at the earliest. The moment it comes, you can start using AED for defibrillating the patients so that the cardiac rhythm can become to a normal sinus rhythm. Let's see step by step how to give AED in this algorithm. Now, moment you get an AED, we have to provide defibrillation at the earliest, and the reasons are so many. The probability of success defibrillation diminishes with time, so give them at the earliest. So moment it arrives, start giving it, and we have seen it that the survival from cardiac witnessed ventricular fibrillation, sudden cardiac arrest decreases every 7 to 10% per minute if no CPR is done. And survival from witnessed ventricular fibrillation decreases every 3 to 4% per minute if bystander CPR is not done. So this means not only the earliest CPR, but the earliest defibrillation should also be taken care of so that the rhythm could be converted to a normal sinus rhythm at the earliest. So the moment the AED comes, you have to do 2 things. You attach the AED and analyze the rhythm. Now, when we say the AED, it is an auto prompt equipment. So the moment you switch it on, it will auto prompt the subsequent step. But remember, when you are attaching the leads, do not stop chest compression. I'm emphasizing this point again. I mentioned it earlier also that during the attachment of the leads or the pads of the AED, you don't have to stop the chest compression. Continue, and the other person who has brought the AED can attach the AED pads accordingly. In case situation when you are analyzing the rhythms, when the pads has been attached, now it's a time to analyze the rhythms. At that time, nobody should be touching the patient. Otherwise, there could be many artifacts. Now, once you analyze the rhythms, there could be 2 situations. One is it says it's a shockable rhythm, or it could be a non-shockable rhythm. Now, in case it is a shockable rhythm, you have to provide 1 shock. Now, in case if you are using AED, then it is an auto-selected joules. It will automatically charge and deliver once it is prompted to press the button for delivery of the shock. In case if you are using defibrillator, you need to start with 120 joules and then escalate it further to 150 and 200 joules and subsequently further on. Now let's see if you are available with AED, how to use it. Now the first step for any AED, it could be of various manufacturers. The first step is turn on the AED. The moment you turn it on, it will be an auto prompt. It will tell you the next subsequent steps. The next step will be expose the chest and attach pads. But remember, as I mentioned earlier, you don't have to stop or interrupt CPR when somebody is attaching the pads of the AED. Once the pad has been attached, analyze the rhythm and do not touch the patient during this step. So once ensure that the patient has been analyzed and it says that the shock needs to be delivered. Again, at this point of time, when you have to press the button for delivery of shock, again, nobody should be touching. You have to check visually and speak loudly that I am clear, everyone is clear, so that nobody is touching the patient at this point of time. And thus, press the flashing button on the AED that delivers the shock. And the moment that shock is delivered, you have to resume CPR immediately, starting with the compressions and breath. So 30 chest compressions and breath, 5 cycles needs to be continued. In case if the rhythm is not shockable, in those situations, obviously shock needs not to be delivered. You have to start the CPR again, which again comprises of 5 cycles of 30 chest compressions and 2 breaths. Now these 5 cycles, 30 chest compression will be continued for 5 cycles, and after 5 cycles, the AED will auto prompt to check for the rhythms again. In case if you are using a defibrillator, in those situations, you have to check the rhythm manually and take decision whether it is a shockable or not shockable rhythm. Accordingly, if it is shockable, give another shock, which may be of escalating energy. In case of non-shockable, you have to resume CPR again. Now this cycle of 30 compressions and 2 breaths, 5 cycles will continue till the patient becomes responsive, or this means the patient shows some response like moving, coughing, or vocalizing, or you find that the patient is having a pulse and breathing, or the victim is shifted to a medical facility because this is outside the hospital. You have already called for help and the patient is being shifted or has been shifted to the hospital. In those situations, you can hand over the subsequent management of CPR to the trained personnel inside the hospital. Now, in case if the patient starts breathes normally, this means you have return of spontaneous circulations with breathing, you can place the patient in recovery position. Now, this is a simple step wherein you can place patients who may be having a little unconscious or drowsy, but they are having good circulation, that is the carotid pulse, and they're breathing normally. They need to be placed in recovery position, and it is simple. The side on which you are sitting, you just make the patient's hand 90-degree bent. Keep the other hand over the other ear. Fold the contralateral knee to 90-degree. Hold the knee and the shoulder and turn the patient to a lateral position. Now, this position is very stable. The airway remains opened up, and in case if patient has any vomiting episodes, all the vomiters will come out and not going to lung. And this position needs to be observed every couple of minutes, 2 minutes. And in case if you think that patient is not breathing appropriately or is having loss of consciousness or patient is having absence of pulse, then you can make the patient straighten up and start the algorithm of BCLS once again that we have just discussed. So this is what basic cardiopulmonary life support is there. We have to follow these 4 links that we discussed here, and these all 4 links can be translated into the algorithm here, and you can follow them step by step so that the chances of patients' recovery is much increased. And when these patients are shifted to hospital, the chances of further management and the optimal outcome is much better if they have received the CPR before they arrive into the hospital. If you want more details, you can go to the website www.cprindia.in, and we have all the information related to the CPR of basic cardiopulmonary life support on this website. Thank you so much. Namaskar. I am Dr. Rakesh Garg. Today, I'm going to discuss one of the very important skill in medical science, which is called as cardiopulmonary resuscitation. Everybody of you must have listened about sudden cardiac arrest, or a person who is mobile suddenly faint and fall down because of many reasons. And the cardiac arrest is one of the manifestation of all those events. In this situation, the cardiopulmonary resuscitation is one of the very important aspects to revive the patient. Taking this into consideration, the Indian Resuscitation Council, which is an affiliate to Indian Society of Anesthesiologists, have formulated their own guidelines of CPR in 2017. These guidelines were categorized into 3 aspects depending upon the need and the place where it is required. For the layperson outside the hospital, a guideline nomenclature as compression only life support, COLS, was made. For trained paramedics and medics outside the hospital, basic cardiopulmonary life support, BCLS, was formulated. And for any resuscitation inside the hospital by trained paramedics and medics, comprehensive cardiopulmonary life support, CCLS, was formulated. So these were the 3 guidelines which are standalone guidelines that can be done at 3 different places by trained persons or by layperson, and they were associated with also some important links that needs to be followed and understood by somebody who is doing cardiopulmonary resuscitation for any victim or patient who has gotten cardiac arrest. So today we'll be discussing about the compression only life support, COLS. This guideline is made for layperson if they want to revive some patient outside the hospital who has cardiac arrest outside the hospital. These guidelines has been published in November issues of Indian Journal of Anesthesia in 2017, and the details of these guidelines can be read from this published manuscript, which has been published in the Indian Journal of Anesthesia. Now, this could be a common scenario. You observe a person who suddenly collapses in front of you, or somebody is already collapsed when you saw him or her for the first time. In this situation, we have to follow certain steps. We need to understand those steps so that the patient's outcome becomes much better. Obviously, we have to recognize the person that he hasn't gotten cardiac arrest. We have to call for help. The other important aspect that needs to be understood is that we have to start the chest compression, and obviously we have to shift them to the nearest hospital. Now, these three links are the most important links, and they have been called as 4 links in the adult CLS. Let's see what these links are. The first is the early recognition and activation. When a patient gets in cardiac arrest, he may be having some premonitory symptoms like chest pain, or he may be feeling dizziness or breathlessness. In those situations, he can subsequently have a cardiac arrest. We have to recognize the situation that he actually has some issues with the heart, and probably patient requires some type of cardiac support. So once we have recognized them, it has to be done very early at the appropriate time, and then we have to activate the emergency services so that the patient can be shifted to hospital timely. The second important link is that we have to start the early chest compression.
Sir, we are not able to see the video, but we can hear the audio,
so
sir.
we have to provide them external chest compression for these patients. The earlier we provide, better is the outcome. And finally,
Sir, no, sir, we are actually able to hear the audio,
we
sir.
have to shift the patient earliest to the nearest medical facility so that the patient can be managed successfully. Now, these 3 links, these 3 concepts, we have to translate into stepwise approach, as this has been done into this algorithm. So we'll go step by step at how these main important components or the links can be translated into actual situations when we are performing CPR for a patient who has got cardiac arrest by a layperson. The first and the foremost aspect is that you have to ensure safety of yourself and the victim. So we have to ensure a safe place. There could be many situations. It could be an accident scenario. It could be a house on fire. It could be a vehicle on fire. It could be a place where there is a risk of electrocution somewhere. So in this situation, some of the areas could be a risky one. So in this situation, if a layperson or a rescuer try to approach to resuscitate a victim, he can harm himself. So we have to look for the scene to ensure that there is no imminent danger or threat to the self as a rescuer, and definitely to the patient as well. So what we have to do in this situation? We have to shift the patient to a safe place. We can take help from the bystanders who are standing there. We can call the ambulance services. We can call the fire brigade people. We can call the police also. So those people will create a safe situation, or the patient could be shifted to a safe place so that the patient could be subsequently resuscitated. Once we have ensured the safety of the place by shifting the patient, then we have to check the response. Now, this response has to be checked while coming from, so we can call from mobile and keep the speakerphone on. If somebody is there in the vicinity, a bystander or some other person, we can call him, we can call for help to him so that he can call for help, so that we can save some time to do the subsequent steps of CPR. Whenever we give a call or whenever we give an instruction to somebody to call for help for the medical emergency, we have to give them certain important information so that the emergency help reaches us on the correct time. So that needs to be remembered by us. Whenever we call to the emergency number, we have to identify ourselves, identify the exact location from which you are speaking, because you want the help to be reaching at that particular place. So you should be very clear about the location. Tell about the victim's condition, including the number of victims, the patient approximate age and gender. And probably if you think he was talking to you, he was complaining of some symptoms like chest pain, you can communicate to him, including the general condition, and the availability of number of rescuers that you have. Sometimes there could be a communication gap when we call somebody on mobile. So assure that the information has been transmitted to the other person, and hang only when you have been asked to do so, so that the help can reach you on the time. Once you have called for help, now is the time to start. One of the very important aspect is the chest compression. So you have to start the chest compression immediately without undue delay for it. Now, when we say the chest compression, the chest compression comprises of manual compression of the chest, and this has to be done 30 times continuously for 5 sets. So this means approximately 30 sets, 5 times approximately 150 chest compression needs to be done. Now, this chest compression, it's very important that we should do it correctly, in a correct way, so that the outcome is good. So the first step would be to identify the place where we have to do the chest compression. The best aspect to identify the place for doing a chest compression is, as you can see in this figure, that we have to identify the chest bone, the breastbone, which is also called as sternum in medical language, but we usually call breastbone. So you palpate your breastbone and go on to the lowest border, as you can see in this figure also. So when you go in the lowest figure, just keep 2 fingers above the gyphoid process, that is the lowest end of the breastbone, and keep the other heel of the hand above the first one, as shown in this figure, and interlock both the fingers, as you can see here. Just to summarize once again, you have ensured the safety of the place, you have seen that the response, you have called for help, subsequently you have to start chest compression, identify the lowest end of the sternum or the breastbone, keep your 2 fingers, as we can see in this figure, keep the other hand, the palm of the other hand, heel of the other hand over those 2 fingers, and the second hand over the first one, as you can see in this picture. Once you have done it, you have to keep your elbow straight. Your shoulder, your elbow and wrist should be in the straight line, as you can see the straight line here. And shoulder should be above the victim's chest. So you have to make your position accordingly so that your shoulder, your elbow and your wrist remains in the straight line. Fingers should be interlocked. And then subsequently, you have to start compressing on the chest. You have to push at least 5 centimeter, but not more than 6 centimeter. And the speed of this compression should be at least around 120 times per minute. The compression speed should be maintained 120 times per minute, but allow the complete chest recoil between compression without lifting hand from your chest. Do not stop chest compression unnecessarily for other reason. It has to be done non-stop. When you are doing 30 compressions in one set, you have to make a time balance. So chant loudly 1, 2, 3, 4, 5, 6, 7 till 30.
Hello?
So this will allow you to count the number of compressions so that you can maintain the time also. And when we speak louder, the compression speed will be around 120 times per minute. If there are more than 1 person, the chest compression can lead to rescuer fatigue. You can always change after 5 cycles of the 30 sets of chest compression. Once the 30 set of chest compression has been done, you have to see for the response. Now this response is different from the earlier check response. In this, you have to see that whether the patient is moving, coughing or vocalizing. In situations where these signs of life in the form of movement, coughing and vocalizing are present, this means the patient is probably responsive. If they're absent, this means non-responsive. In case patient is responsive, then again, you have to observe the patient. You have already called for help. This means you are observing the patient. The moment the emergency help comes to you, you have to shift this patient to the hospital. In situations, if the patient remains non-responsive, you have to start again the 5 sets of 30 compressions again. So 30 chest compression, 30 chest compressions, 30 chest compression, 30 chest compression, 30 chest compression, again 5 times. And then again, you have to check for the response. So this cycle will continue till the patient becomes revived or the medical help arrives, trained rescuers are available for you, or sometimes the patient gets revived where there are obvious signs of life. At times, the rescuer becomes exhausted or the place becomes unsafe. In those situations, you can stop the chest compression for a moment. In case there is somebody nearby, you can take their help so that the chest compression could be continued further on. In case the patient is responsive, and you are awaiting for the emergency services or the ambulance that comes to you, at this moment of time, you can place the victim in lateral position. So this is how you can single-handedly, single person, you can do a lateral position of the patient. If a patient is lying supine, you can see in this figure, you can just fold the arm of the victim as shown in this figure, and then put the other arm across the chest, across near the opposite side of ear. Fold the limbs on the opposite side to 90 degrees, and holding the shoulders and the knee, you can twist them to lateral position And this position is appears to be quite stable position. In case if a patient have some vomiting, then he will not be aspirating it. Aspirating the contents will not go into the lungs. Also, this patient will keep the airway open. So keep this position, but then remember you have to observe the patient quite frequently here, maybe every 1.5 to 2 minutes. And in case if you think that patient is having some issues, you can make him supine again and start and look for whether patient requires subsequently again the chest compression. There would be a situation in which you find a victim which has collapsed, but the situation will be that you don't need to start the CPR. The situations would be if the scene is not safe, because your safety will be at risk. The patient is responsive. Patient has signs of irreversible death, like the rigidity, the rigor mortis. If such situation happens, you need not to start the CPR in this situation. So in a nutshell, we have just talked about doing chest compression only life support, cardiac compression only life support calls for patients who sustains cardiac arrest outside the hospital. And in case if any lay persons wants to do CPR, we have to follow this algorithm, this chain of links, so that the patient survival becomes much better. The more information can be seen from this website, www.cprindia.in. We have all informations related to layperson CPR on this website that you can look for. If you have any queries, you can get back to us for any subsequent training programs related to the compression only life support, which is an initiative of Indian Resuscitation Council. Thank you so much.
Thank you, sir. Now I will show you the use of AED. When there is a necessity for use of AED, what we have to do, I will show you.
Hello, this is Dr. Shruti Arabati Patki, MD anesthesiologist. Under the aegis of the Indian Society of Anesthesiologists and the Indian Resuscitation Council, that is the IRC, we bring to you compressions only life support. For the event of World Anesthesia Day, which is celebrated every year on the 16th of October, we bring to you an educator video on CPR and other life-saving techniques. What is CPR? But before we talk about CPR, what is cardiac arrest and what is heart attack? Did you know a heart attack and cardiac arrest are two different events? A heart attack, to explain in very simple terms, is a plumbing problem. For example, the heart has different blood vessels giving blood, supplying blood to different parts of the heart. Now imagine these three are the blood vessels supplying to this heart. If one of them gets blocked, this part of the heart will not get any blood supply. It gets blocked. You must have heard of 70% blocks, 80% blocks, 50% blocks. These are nothing but your blood vessels which have become blocked and the blood supply to that part of the heart has stopped. Now, that part of the heart begins to die. The remaining heart is still pumping away. The part that is dying will start sending out signals of pain. The patient will present with nausea, that is sensation of vomiting, a lot of perspiration and sweating. The patient will sense a feeling of doom, that is, the world is coming to an end. The patient will present with a lot of chest pain, mostly, many times, on the left side of the chest, which radiates along the left arm. But they can also present with lower back ache, symptoms of indigestion, feeling of constriction in the chest, like something very heavy has been put onto the chest. Now, all of these symptoms, the patient will be able to actually explain. That means the patient is conscious, the patient is able to talk, the patient starts to breathe heavily, he starts to feel breathless maybe. All of this is when the patient is actually conscious and able to communicate to you. But when it's a cardiac arrest, do you know what happens? The heart just stalls, it just stops, it arrests. That means the entire heart has gone into fibrillation or something like this. It goes into a tremor kind of a phase. And that is when the circulation of the body is completely stopped. Mainly to the brain, the circulation is completely stopped. So the first symptom that you see when there's a cardiac arrest is the person or the patient will immediately collapse to the ground. And they will not be absolutely responsive. They will be like a dead body lying on the floor. So we will be talking about what the steps to conducting the CPR are. In case of a heart attack, you make the person sit down first. There should be no walking around. There should be no form of exercise. There should be no walking, talking, or there should be no exertion of any kind. The person should be immediately taken to a cardiac center where the cath lab is functioning. All right. And what do you do when when you're suspecting a heart attack? The first and foremost thing is to open all the doors and windows, make sure the person is able to ventilate, able to breathe a lot of fresh air, and open out his clothes if they're tight, and reassure the patient and immediately transfer him to a place where there's a cath lab working 24/7, there's a cardiologist available 24/7. So why CPR? Why does the CPR help your victim survive a cardiac arrest? How does it do it? Now, the science behind CPR is that when the heart just stops, it's fibrillating, it's not doing its work. There is no circulation. The circulation of the blood is completely cut off. So, what do? You become the heart of this victim. By becoming the heart of the victim, what exactly are you doing? You are making sure that the blood supply to the brain is continuously maintained. Why is this so important? Because the brain is such a very sensitive organ in your body which loves oxygen. You cut off oxygen from the brain for 3 minutes and the brain cells begin to die. By the end of 5 to 8 minutes, complete damage to the brain cells has begun. And you don't want that. Because even if you bring back the heart, say after 20 minutes, your brain will have suffered a lot of damage. The person can become comatose for life. He can become brain dead for life. Maybe you've heard of different victims who've been on ventilators for years together, a vegetative life. You don't want such a victim for anybody, right? In anybody's family. You can't help a victim, bring them back to life, and declare them brain dead. That is the reason why it's so important that you start CPR and keep the brain alive. And hence we insist that you continuously provide CPR without interruptions till help arrives. It's very important that you continuously provide CPR without interruptions. So let's imagine this is our victim of cardiac arrest. Now you may actually witness him falling on the ground, becoming unconscious, or you may come across this patient who's already fallen on the ground. How do you recognize or identify whether this person has suffered from a cardiac arrest or is a mere fainting? We get many questions like these. What if the person has just merely fainted? How do you know it's a cardiac arrest? How do you know? With 3 signs. The first thing that you do is make sure you are on a scene that is safe. For example, if there is electrocution or the victim has suffered from an electric shock, then make sure that all the mains, the electrical mains of the place have been shut off. You're wearing rubber-soled footwear. You have a wooden stick in your hand and only then you will approach the victim. Or if the victim has fallen down in the middle of a traffic or in the middle of the road, make sure you bring other people, take their help, make a human chain, stop the traffic, then move on to the victim, move into the sidewalk, and then assess the patient. Please make sure that you don't fall, make yourself come into danger or do something that will harm you. The scene has to be safe for you before you can help someone. So once you've assessed scene safety, you move on, and the first sign that you will check is a response. How do you check for response? You will tap on the victim's shoulders and shout, "Hello? Hello? Are you okay?" You will do that on both the shoulders and you will shout loudly. If the person is suffering from cardiac arrest, there will be no response at all. He will lie there like a dead body. But if the patient is fainted or there's some other reason of the unconsciousness, then they will either mumble, they either grimace, they make a face, they either wince, close their eyes, move their fingers. There will be some sort of response. But a cardiac arrest victim will not have any response, which is called as unresponsiveness. The second sign that you will look for is breathing. You will bend to one side and look at the patient's chest wall movement. You might hold your fingers at the nose of the victim and feel for breath at your fingers for not more than 10 seconds. At least for 5, not more than 10 seconds. You will look for regular breathing movements of the chest. If you find that the person is breathing, then that means that there is a response. That means it is not a cardiac arrest. But if there is no response and there is no breathing, this is a cardiac arrest. And now, friends, is the time to begin your CPR. But before you begin CPR, calling for help is the most important thing. Do call for an ambulance. The Indian number, the universal number in India for calling for a cardiac ambulance is 108. Or if you know a local ambulance number, you might call them. Once you've called for help, if you're alone, you can put your phone on the speaker and call for help. Or you can use a passerby's number. You should begin CPR. That's cardiopulmonary resuscitation. How do you do that? The first thing, like you saw me do, is adjust yourself. You do not sit on your knees, you stand on your knees. All right? You have to stand. Look at me. I'm standing on my knees, not sitting. So you have to stand on your knees and you have to look for the center of the chest. How do you do that? You look for the place where the ribcage meets in the center. Both sides of the ribcage will meet in the center here. You will look for a place 2 fingers above this point. This is going to be the center of the chest. There you should place the heel of your palm, the dominant hand. If you're right-handed, you should use your right hand. If you're left-handed, you use your left hand. Use the other hand to pull back the fingers of the first hand. So only the heel stays in the center of the chest. And then you should make sure you use the weight of your body and the movement will be at the hip joint, and make sure you compress the chest. You will press the chest down for 5 centimeters and make sure the 5 centimeters of the chest is a recoil. It's a complete recoil when you pull back. Such compressions, how fast will you give them? 2 compressions every 1 second. That means 120 compressions in 1 minute. That's how fast you'll do it. You should listen to the count, the rhythm of the count, the way I do it, and that is how you should do it on your victim. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So that is how you do the compressions in the counts of 30, 5 cycles. And by then you might become tired. And so you will require another compressor. You will require someone to take over for you. So that is how you continuously provide compressions till medical help arrives, which is going to benefit the patient. If you saw how I did it, you should see that my chest wall was pushed 5 centimeters inside and came out completely 5 centimeters. This is extremely important. So make sure you learn how to give these compressions. Having said that, this you should continue doing till you get tired. By the end of say 1.5 to 2 minutes, you should get tired and you will require someone else to take over your job. You'll continue compressions till medical help arrives or a cardiac ambulance arrives, or you take the patient to a cardiac center where the person will be treated for cardiac arrest and can be revived.
So friends, this was COLS, compressions only life support.
So now I told you, I have actually shown you how practically the compression takes place. So this is one of the, actually a repetition of the video that was already told, but here I will show you a small part of the AED. What is it? That is external automated defibrillator. I will show you. So what happens is, in foreign countries, many of the places the AEDs are kept so that it can be used when necessary. So here I'll show you one situation that happens in abroad. So now
A
you
safe
see.
station houses an automated external defibrillator, or AED, that is for anyone to use. In the event of an emergency, it's important we all understand what to do until medical help arrives, because every second matters.
Zach, can you hear me? Can you hear me? Zach, can you call 911, tell them we have an unconscious male and report back to me once you're done?
Yes.
Perfect, thank you. Kate, can you go grab the AED from the safe station? Do you know where it is?
Yes.
Bring it back to me once you get it.
Unusual breathing or gasping is common during sudden cardiac arrest. This is called agonal breathing. If someone is not breathing normally, you need to begin CPR immediately.
ఎక్కడ కేర్ హాస్పిటల్
Unit, okay. Adult patient selected. If patient is a child, press child button. Cut or tear clothing to expose patient's bare chest.
అవన్నీ ఏం కావాలి చెప్పమండి ఏంటంటే వేరే క్లాసులో
Open pad package.
ఇవాళ తెచ్చుకోవాలండి వాళ్ళకి
Attach pads to patient's bare chest.
నేను చెప్తాను మా తులసితో చెప్తాను పేరేంటి అని పేరు సున్నాను చెప్తాను నేను క్లాసులో ఉన్నాను
Don't touch patient analyzing. Shock advised.
Stand clear. All clear? Shocking now.
Shock delivered. Start CPR. Push to match the tone.
You have to apply the AED like this. One on the right clavicular region,
Don't
one on the
analyzing.
He's breathing.
in the axilla, left axilla.
Okay, now we'll go away.
Both the pads can be able and you can give the shock.
Zach, you're okay.
How to use the Zoll AED3 on a child. After turning on the machine, you will have the option to press the pediatric button.
Unit, okay.
You will use the same set of pads as you would for an adult.
Adult patient selected. Patient is a child. Press child button. Child patient selected.
Open the pads and place the purple puck on the center of the chest between the nipples. The green pad will then be placed on the front of the child. Place the blue pad in the center of the back, between the shoulder blades. Continue to follow voice prompts until medical help arrives. Always be on the lookout for the nearest AED, and don't be afraid to use it. Keep up with your CPR and AED skills. Together, we have the power to save a life.
So this is how actually we have to use the AED to give a shock. So AED will be having a verbal pronunciation. So it will be telling you how you have to do a shocking and how you have to apply the pads. So this is almost over regarding the theoretical part. Now the people from Lardell will show you, they use their software and they will be showing you how to do the practically, how they will give you the training on the mannequins or your pillow. Now there are about 51 participants. Uzma? Uzma? Uzma?
Yeah, sir. Good morning, sir.
Now you can take up. We have completed this one. There are questions there.
Sir, we will start giving the orientation about how to use the QCPR classroom app, sir. After that, we will have the hands-on session, sir. Is that okay, sir?
There are some questions. Where to place the AED pad? There are two pads of AED. One pad has to be kept on the below the right clavicle. Another pad has to be kept below the armpit of the left side. So this is enough, and it will give automatically the amount of shock that has to be given. The only thing is, it will ask you to push the button, you have to push the button. I think you have seen it, everything. Okay, now you can take over.
Thank you so much, sir.
Thank you.
Good morning, all the participants. Thank you for joining today's. Now we will be having a hands-on session about the CPR delivery, for which we have an application called QCPR Classroom app. I would request all the participants to please follow the steps which I am going to show currently. And after that, you all can have a hands-on training session. So now I would share my mobile phone screen and show you all how to download the QCPR Classroom app and how to use the app for hands-on CPR session, through which you will also be getting the CPR feedback.
Hello. సూర్యనారాయణ ఎవరో ఉన్నారంట, డెంగ్యూ ఫీవర్ అనుకుంటా. వెళ్ళిపోయారా? గొడవలు.
So if it is clear for everyone, I will now start sharing my screen. All the participants, please do follow the steps which I am doing it on the screen. So I would request all the Android users to please get to the Play Store. And if you are an Apple or iPhone device user, then please open your App Store.
Oh, no.
So you will have an application called QCPR Classroom app. We have even put the application name in the chat box.
Thank you.
The app name is QCPR Classroom app. Everyone, please open it and download the QCPR Classroom app. Please do not get confused between QCPR training and QCPR Classroom. The app which you all need to download is QCPR Classroom. Please see it on my screen. So I would request all the participants to please download it. We will have 2 to 3 minutes for downloading the application. If you all are facing any difficulties in downloading the application, please let me know. We will help you out accordingly.
Hello.
Yes, sir.
అదే రాత్రి ఇక్కడికి పోయారు, అపోలోకి వెళ్ళారంట. అపోలోలో పోయినట్టు వీళ్ళు కాంప్లికేట్ అయ్యేలాగా అనిపించింది. తర్వాత చాలా డిమాండింగ్ గా ఉన్నారండి.
Is everyone able to download the app? If you're facing any difficulties, please do let us know.
Classroom code, ma'am.
Just a second, you are a step ahead. I will tell you the classroom code.
Yeah, sure. Okay.
Okay, so once everyone has downloaded the application, please open it. So is everyone able to see my screen? Once you open the screen, this is how this is how your screen will look like. In the bottom, you can see an option learner. Enter your classroom code and join a class. Please click on go, green color button go. So now it will ask you for a classroom code. I am just using a dummy classroom code now. The original classroom code will be discussed with all of you once we start the actual hands-on session. Now, no need of entering the classroom code. Please just observe what I'm doing on my screen. So for me, the current classroom code is 384209. So when we start the actual hands-on session, I will be giving you a 6-digit classroom code. Once you enter the classroom code, please click on enter. Once you click on enter, it will ask for your name. Please enter your respective names. so that we can know who is performing CPR and we can give you the feedback accordingly. So please type your name and click on join class. Once you click on join class, it will ask you for a permission. QCPR classroom is asking to turn on Bluetooth. You can deny the permission since you are not using any sensorized mannequin for performing the CPR. Please deny the permission. Followed by that, there is in the bottom of the screen, you can see don't have a sensorized mannequin, press here. I would request all the participants to please click on press here. So once you all click on press here, this is how your mobile phone screen is going to look like. It will ask you to place your phone next to your compression device. So since most of you all do not know, you can perform the compressions for CPR on a pillow or on bare floor or on tabletop. So when you're using a pillow, please make sure that you're placing the phone next to the pillow. If you're using tabletop, please make sure you're placing the phone on the table and click on OK next. Once you click on OK next, it says a prompt, make sure your face is in the frame of the camera. So I would request all of you, when you're placing your mobile phones next to the compression device, just make sure that your face is visible in the camera frame here. So you all can see a camera frame which gets opened automatically in the top right corner. Okay, so please click on, if you can see my screen, I am placed in a way that my upper torso and my head is visible in the camera frame. So please make sure your face in the frame of the camera and click on OK next. Followed by that, it says that when you are performing the compression, try to stay in the green range. This green range is an indication that you are performing CPR correctly. So when you are performing the compressions, if you can see my screen, I'm trying to stay in the green area. This green area indicates that your average compression rate is somewhere between 100 to 120. As we saw a video what Chakra Rao sir played. To increase the rate of survival, your average rate of compression should be 100 to 120. So please click on OK, got it. And now you can start performing the compressions. So if you can see my screen currently, what I am doing is I am performing the compressions on a pillow.
Usma, you tell them only 120 and not 100 to 120.
Fine,
It
sir.
should be
Okay.
120 and a minimum of 115 or 118. There is no question. Because it will not match 60 seconds, two compressions for every 2 seconds, every 1 second. That is it has to match.
Okay. So as Dr. Chakra Rao sir said, you need to maintain your compression speed to 120 compressions per minute, which can be a minimum of 118 compressions per minute. So what I'm doing currently is I am on my knees. I have kept my elbow straight and I am performing the compressions on a pillow. I have made sure that my face is visible in the camera frame and I am performing the compressions. So if you can see, my compression range
You
is
have to
within.
stand on your knees just like Shruti has shown you in her video. You have to
Yes,
stand
sir.
on your knees.
Yeah. So you need to make sure that you're performing it within the green range, which is the ideal rate for increasing the rate of survival of the victim. And if you're doing it too slow, it will point an arrow mark towards the right. Like if you see on my screen, I'm performing too slow now. It shows on the left, which means that I'm doing it too slow. And if I'm doing it too fast, it will show towards the right. So you can see your live feedback and you can improvise on the CPR compression that you are performing. So everyone, we will start the actual session now with the new classroom code. Everyone, please be ready with your positions. If you all have any doubts related to this, please feel free to ask me. We can help you out in performing it. So with me, I also have my colleague, Mr. Reshant. You can ask him also. We will be able to clarify your doubts. Is it clear for everybody how to use the QCPR classroom app? Okay,
Is
so
it possible to tell one more time, ma'am?
sorry.
Is it possible to tell one more time, ma'am?
Yeah, sure. I'll repeat it for you. So I'm sharing my screen once again. I would request if you're an Android user, please open your Play Store. Similarly, if you're an Apple or iPhone device user, please open your App Store and search for this application named QCPR Classroom app. Please do not get confused between QCPR training and QCPR Classroom. You need to open QCPR Classroom app. We will have 1 minute of time. You all can please download it. Once you have downloaded the application, please let me know. We will move further. Okay, so once you have downloaded, please open the application. Once you open the application, this is how your screen will look like. In the bottom, you have an option called Learner. Enter your classroom code and join a class. Please click on Go. Once you click on Go, it will ask you for a classroom code. This classroom code, which I'm using currently, is a dummy classroom code. The actual classroom code for performing the hands-on will be shared with you once we start the hands-on session. Please click on Enter after entering your classroom code. It will ask you for your name. Please enter your respective names so that we can know who is performing the compressions, so that we can guide you on how you are performing it and we can give you live feedback. Then if you can see, it will ask you for a permission to turn on Bluetooth. You can deny the Bluetooth permission since you are not using any sensorized mannequin to perform the hands-on chest compression. And now if you see on the screen in the bottom, you have an option, don't have a sensorized mannequin, press here. I would request every one of you to please click on press here. You can perform the compressions on a pillow or on tabletop or on bare floor. So if you're using it on a pillow, please make sure that you're placing your device next to your pillow. If you're using it on a table, please place your mobile phones on the table and click on OK next. Okay, once this is done, it will ask you for a prompt saying make sure your face is in the frame of the camera. So what you need to do is once you place the phone next to the compression device, please adjust yourself such that your head and your upper torso is getting covered in the camera frame in the top right corner, and please click on OK next. Now it says a prompt, this shows your compression rate, try to stay in the green area. So what you have to do is please click on OK, got it, and start performing the compressions. So if you're doing it correctly, it will show you in the green range. This green range indicates that your compression speed is somewhere between 118 to 120. The average compression rate which is required per minute ideally to increase the survival rate of a patient is to maintain it within 118 to 120. So your speed meter should be within the green range, which indicates you're doing it absolutely correct. And if you're doing it too slow, as I'm doing it right now, it will give you a feedback pointed towards the left, which means that my compression speed is too slow and I have to increase my compression speed. Similar way, if you're doing it too fast, the button will point towards the right, which means that I'm performing it too speed and I have to slow down my compression speed. So the ideal way to perform is to give 120 compressions per minute, which comes for 2 compressions per second, to increase the survival rate of the patient. Is that clear for everyone? This is how you need to perform the compressions. When we share with you the classroom code, we will be able to monitor you from here live, and we will give you the CPR feedback. Is that clear for everybody?
Yes, ma'am. Thank you.
Yeah, thank you so much. So what we will do now is we will split the targeted audience into 2 groups, where in one room I will be the instructor, where I will be generating the classroom code. And in the second room, I have my colleague, Mr. Reshant. He will be generating the classroom code and giving it to you. Is that fine for everybody? If you all have any doubts, meanwhile, you can please ask us. We can help you out accordingly. Is it clear for everybody? Reshant, are you clear? You have been allocated to room 1. I will be in room 2.
Okay.
Okay. So everyone, you will be receiving a request to join into the breakout room. Please accept it and split into the respective breakout rooms accordingly. All the best, everyone. Have a nice session. We are starting the breakout rooms now. Sir, everyone has returned to the main session, sir. Thank you everyone for taking part in the hands-on session for CPR. I hope you all enjoyed it and learned a lot from it. Over to you, Dr. Chakrarao, sir.
Any doubts regarding this? You're all from India or different places?
Mr. Mohit, we see that you were unable to download the app. Were you searching for the same app like QCPR Classroom app?
No, if they want any problems or they have any problems, let them ask to join tomorrow. Tomorrow we are conducting anywhere.
Oh, okay, sir.
Hmm?
So people have joined even from abroad, sir. One
Okay.
person is from Oman.
Sir, can I request one thing, sir?
Please.
Since we have little time, sir, and there are around 42 candidates, sir, can we have one more session, because 1 or 2 people said they were not able to do it. So since we have, it will not take more than 15 minutes. So rather than going to the breakout rooms, all 42 can join if they want to practice more, sir.
Yes, that's good, Uzma. Hmm?
Yeah,
You
okay,
repeat
sir.
it. You make another round.
Yeah, sure, sir. Without breakout rooms, we will do it here only, sir.
Okay.
So now all the participants, please open your QCPR classroom apps. We will be having a new classroom code without breakout rooms. Everyone, please be ready with the QCPR classroom app. The classroom code is 150220. I repeat, the classroom code is 150220. Okay, very good. Participants are joining. We will wait for another minute. So we have 21 participants. We will wait for another minute. The classroom code is 150220. Okay, very good. We have 27 participants. 28. Mohit, you can please search for the, if you have another phone, you can please search from the other phone. Maybe there is some issue with your phone, so you're not able to find the QCPR classroom. Rishan, can you please post the link for the application in the chat box?
Yeah, sure.
Thank you. For the ones who are not able to find it on your mobile phone screens, please look at your chat box. My colleague Deshant is pasting the link. Please click on the link and download it on your mobile phone screens. Kushabu, there is no need to go for the breakout room now. Since everybody is performing in the same room, there is no breakout room as such. How to join CPR classes? Please download the application QCPR Classroom app on your mobile phone. The link is there in the chat box. Reshant has posted it. Please click on the link and download the app. Once done, please open the app and enter the classroom code, which is 150220. Enter your name and you can perform CPR. We will wait for 1 more minute and then we will start the session. Meanwhile, every one of you can start performing the compression practice. So I can see many of you all have started performing compressions. Usha, you have got disconnected. I would request you to please rejoin. All the participants, please do not toggle between Zoom application and QCPR Classroom app. Okay, so everybody, please take your positions. We will start the 1 minute session now. 3, 2, 1, start. Very good. Anushri performing well, Vignesh performing well, Jyoti performing very well, Jyoti Singhal performing good, Alice very good, Kavya good, Pratiksha good, Shabana good. Okay, very good. Manisha very good, Sarita very good, Abhinaya very good.
CPR training नहीं था क्या था?
Preeti performing very well. Kushabu Shukla very good. Savita very good. Abhinaya, Sarita, Jyoti very well. Anushri, Naik and Jyoti am maintaining the speed consistently. Very good. Tina, Vignesh, Abhinaya, you all are also doing very well. Savita, please slow down your compression speed. Rohini, slow down your, increase your speed. You all please make sure that you're maintaining your speed range within the green area. The green area indicates that you are performing very well. Okay, so everyone can stop performing the compressions. We are at the end of the minute. Amazing. Anushri, your score is 115. Rabindra, 115. Sanathoy, 117. Jyoti, 113. Vignesh, 112. Jyoti M, 112. Sarita, 109. Abhinaya, 116. Tina, very good. Exact 120. Alice, 115. Good. Kavya, 120. Good. Kushabu Shukla, 114. Good. So we have 2 participants who have performed the exact 120 and they are Tina and Kavya. Very well performed. All the other participants, whoever is having it under 100 compressions, please try to increase your compression speed. The people who have performed it above 120, please try to slow down and perform it within 120. So if everyone is okay and ready, we will do it for 1 more time. And this time we will do it for 2 minutes. Is everybody ready? Okay, please take your positions. We will start at a countdown of 3. 3, 2, 1, start. Anushri, very good. Sanothai, very good. Jyoti Singhal, very good. Jyoti M, very good. Sarita, good. Vignesh, good. Rishma, please slow down your completion speed. Pratiksha, please increase your completion speed. Shabana, increase. Tejasvi, Preeti, please increase. Sheetal and Komal Saini, slow down. Pooja Garg, please increase your speed. Khushbu Shukla, increase your speed. Okay, so guys, please try to maintain it within the green range, which means that you're performing it absolutely correct. Kavya, very good. Jyoti M, Vignesh, Vinita, Anushri, you all are performing very well. Mohit, you're performing it very well. Rohini, performing well. 1 minute completed. We will have it for 1 minute more. Kavya, very good. Tina, very good. Alice, very good. Ravindra Mahato, please slow down your compression speed. Sarita, please increase your compression speed. Okay, so everyone is performing it very well. We have 40 seconds more. Khushbu Shukla doing it very good. Kavya, good. Neha, good. Tina, good. Anushri, Vignesh, Jyoti, you all are performing it very well. Tina, Abhinaya, Jyoti, Single doing it good. Kavita, please slow down your compression speed. Rohini, increase your compression speed. Okay, so we have 2 seconds. Yeah, everyone can stop performing compressions. So we will have a look at the scores now. Anushri, your average completion rate is 112, good. Sanathoy, yours is 120 exactly, very good. Jyoti, 114. Abhinaya, 118, good. Jyoti M, 115. Vignesh S, 113. Vinita, 117. Alice Riva, 112. Tina, 114. Shavana, 119. Kavya, 117. Sheetal, 118. Rohini, 100. Mohit, 108. So we have Sanathoy who has did it 120 exact. Very well done. So tip for improvement is Sayali, please increase your speed when you're performing the next time. Rabindra, slow down. Manisha, increase your speed. Sarita, increase your speed. Reshma, Vandana, Sushma, you all need to slow down your completion speed. Poonam, Jyoti, Neha, Pratiksha, you all need to increase your speed. Ishani, Khushbu, Komal Saini, Pooja Garg, you all need to increase your speed. So most of you all have performed it good next time. So sir, is this okay or we need to do it for another time, sir? Dr. Rakesh sir or Dr. Chakra Rao sir? Dr. Chakra Rao sir or Dr. Rakesh sir?
I'm muted, that's why I don't know.
Okay.
You do it again another 10 minutes. You can go. One more, please. Somebody is asking.
Yeah. Thank you for the enthusiasm from the participants. Okay, so everyone, please be ready. We will do it for one more time for 2 minutes. Okay, everyone, please take your positions. 3, 2, 1, start. Jyoti Singhal, very good. Leena, increase your completion speed. Sanathoy, very good. Anushri, Vinita, doing good. Jyoti M, good. Kavya, good. Mohit, please increase your completion speed. Savita, Shaila, Khushbu, you all need to increase your completion speed. I see many of you all have got disconnected. Please rejoin. Jyoti Single, Jyoti M, Sanotoy, you all are performing it very well. Leena, very good. Alice, very good. Kavya, very good. Parampreet, please slow down your completion speed. Khushbu, increase your completion speed. Mohit, you're doing well now. Preeti, good. Vignesha is good. Tina, good. 1 minute completed. We will have it for another minute. Shaila, Kavya, Parampreet, you all are performing very well. Please maintain the same. Tina, Alice, Vinita, Jyoti M, Vignesh, Jyoti, you all are performing very well. Please maintain the same speed. Okay, we have 30 seconds more, everyone. I know it's tiring. Please continue. Remember, your 2 hands can save a life. Tina, Vandana, Alice, you all are doing very well. Mohit, please slow down your compression speed. Shaila, increase your compression speed, please. Okay, 5 more seconds. So 3, 2, 1, everyone can stop. Anushri, your average completion rate is 112. Preeti, 114. Jyoti Single, 115. Jyoti M, 115. Vinita, 116. Alice, 112. Tina, 116. Parampreet, 116. Kavya, 116. Khushbu Shukla, 119. So the Khushbu Shukla, you have did it 119. Very good. Please maintain the same. So Sayali, you need to slow down your completion speed. Rabindra Matho, increase your speed. You can see your feedback on your mobile phone screens as well. So if it is below 100, please try to increase your compression speed and try to get it between 118 to 120. Similar way, if you are above 120, slow down your compression speed and try to bring it to 118 to 120. Is everybody clear and okay with this?
Yes, ma'am.
Yes, ma'am.
Thank you. Thank you.
Okay, shall I call Ranveer Singh Tyagi? Hello. Nige 26,000 చెక్ ఇచ్చాను కదా. That's all right. Okay. Hello. I will call Ranveer Singh Tyagi. The course is over, huh?
So from our side, the hands-on session is done, sir.
Good morning, sir. The course is completed. There are only 40, 50 people have attended. If we can give the number, the names and the email IDs, we can send them the certificates. Okay. Okay, sir. Okay, sir. Thank you. Rakesh? Rakesh is not there? I'll talk to Rakesh and...
So meanwhile, we will have a session for 1 minute, sir,
Okay.
as the last time.
Okay.
The participants are requesting for the same.
Okay, then it's good.
Yeah. So All the participants, we will have it for one final time for only 1 minute.
Uzma, I would request you to end the class and create a new code.
Okay.
What do you want?
No, sir, we will give the new classroom code, sir, because many of them have got disconnected.
Okay.
Okay, so all the participants, please enter the new classroom code 827101. I repeat, 827101. It is also there in the chat box. We will have 1 minute time. Everyone please join so that we can have it one last session. Okay, we have 26 participants on board. Everyone, please take your positions. We will start the 1 minute session at the countdown of 3. So guys, everyone ready? 3, 2, 1, start. Tejasvi performing it well. Anushri doing good. Vignesh, please slow down your compression speed. Poonam, please increase your speed. Alice doing good. Jyoti doing good. Jyoti Singhal also doing good. Vinita good. Mohit good. Abhinaya good. Sarita good. Tina good. Kavya very good. Okay, 30 seconds done. We have it for 30 seconds more. Very good. Most of you all are performing it very well this time. Rabindra doing good. Jyoti doing good. Sarita doing good. Tejasvi, please slow down your compression speed. Parampreet, please increase your speed. Shabana, Manisha, please slow down. Sayali, increase your speed. Sanatoy, please decrease your speed. Okay, so all the participants, please stop. We are at the end of the minute. We will have a look at the scores now. So Anushri, your average compression rate is 112. Alice, 113. Jyoti, 117. Jyoti, a single, also 117. Vinita, 116. Mohit, 104. Abhinaya, 114. Parampreet, 101. Sarita, 120. Very good. Kavya, 119. Very good. Tina, 112. Good. Usha, 106. Good. So other participants, whoever has scored below 100, please make sure that when you're performing it for the next time, increase your speed so that it touches 118 to 120. And the participants who have performed above 120, please slow down and try to maintain within 118 to 120. Is it clear for everybody?
Yes, ma'am.
Thank you so much.
Thank you.
Dr. Chakrarao, sir, we are done from our side, sir. Sir, you're muted, sir.
Chakra sir, you're on mute. Okay, sir.
Okay. I'll just show you one small video.
You can save many lives by learning how to provide COLS. If you want to learn more about COLS, kindly log into cprindia.in and enroll yourself. Thank you very much for watching and learning.
Can you see the screen?
Yes,
Can
sir.
you see? Huh?
Yes, sir. I can see, sir.
Okay. I'll go back and show you. This is the. You see this video, how they perform. No, this I don't need.
Even though high-quality CPR has been shown to increase survival,
This also.
What to do when you see someone collapse to the ground.
Thank you.
Be safe. Tap on the both shoulders with both hands and ask loudly, "Hello, are you all right?" Check for normal breathing. If there is no purposeful verbal response or movement or no breathing, call for help. Activate the local emergency medical system and ambulance. Then start chest compressions. Keep the heel of one hand on the center of chest, 2 fingers above the lower end of breastbone. Place the other hand over it, interlocking the fingers. Keep If you see someone collapse to the ground, what to do when you see someone collapse to the ground. Hands and ask loudly, "Hello, are you all right?" And check for normal breathing. If there is no purposeful verbal response or movement or no breathing, call for help. Activate the local emergency medical system and ambulance. Then start chest compressions. Keep the heel of one hand on the center of chest, 2 fingers above the lower end of breastbone. Place the other hand over it, interlocking the fingers. Keep the elbow straight, shoulder above the chest. Push hard, 5 to 6 centimeters downwards. At a rate of 120 per minute.
This already I have shown,
Allow
huh?
the chest to recoil after each compression. Count loudly 1, 2, 3 up to 30. After each 5 such cycles of 30 chest compressions, check for response by moving, coughing, or verbalizing, and for breathing. Do not interrupt chest compressions unnecessarily. Continue compressions till the victim becomes responsive or help arrives.
So you should not interrupt the chest compressions. You have to start the compressions and you should not interrupt. Next, another thing I wanted to show you here is
Hello, this is Dr. Shruti Arabati.
I don't want to show. You see this?
Hey, sudden cardiac arrest occurs when the heart stops beating properly. Sudden cardiac arrest is an electrical problem caused by an abnormality in the heart's electrical system. The heart's pumping action is disrupted, and the heart can't pump blood to the brain, lungs, and other organs. Seconds later, the victim collapses suddenly, appears lifeless, and is not breathing, or is abnormally gasping for air. You may see several seconds of seizure-like symptoms. Not true. Cardiac arrest.
So cardiac arrest can happen to any person, anywhere, anybody.
Although more commonly seen in those who have heart disease, cardiac arrest can also strike those with no history of heart problems at all, and can be caused by recreational drug use, electrocution, or even a sudden blow to the chest. Sudden cardiac arrest is the leading cause of death in many countries, and its survival rate is less than 1% worldwide. No, cardiac arrest is not the same as a heart attack. Think of a heart attack as a plumbing problem. It occurs when blood flow to the heart is blocked. Victims of a heart attack are still conscious and may complain about symptoms such as shortness of breath or discomfort in the chest. In contrast, cardiac arrest victims need help right away. Every minute without help means the chances of survival drops by 7 to 10%. That leaves only a golden survival window of only
They are playing cricket. హలో, అదే ఆయన రకరకాలుగా ఇచ్చారు, ఒక గ్రూప్ పెట్టాను. ఆ, ఆ, 8ంటికి ఎంత ఉంటుంది, 7ంటికి ఉంటే సరిపోతుంది. అది బాగా లేట్ అయిపోతుందంట. సీత పర్లేదు. మొహం కడుక్కొని ఇచ్చేసాడు. మేము ఏ హోటల్కి మాకు వాళ్ళు ఇస్తారు, ఫ్రీగా ఇస్తారు మాకు హోటల్. ఆ హోటల్లోనే బుక్ చేయించేద్దాం. అదే బుక్ చేద్దాం, చెప్తాను. చెప్దాం. అదే 26th అనమాట, 26th ఈవినింగ్. జనరల్ బాడీ అది ఇది మరి మన ఇతను పోటీ చేస్తున్నాడు కదా, మీకు అంటే ప్రమాణ స్వీకారాలు చేసుకుని వస్తాం. అదే అవును, 26 నుంచి ఉంటాయి, 26 25 నుంచి ఉంటాయి. 25 CME ఉంటుంది, అంటే ఆన్లైన్ అయితే ఉంది కదా, దానికి ఇంపార్టెన్స్. అదే అదే పెట్టాడా? ఇది పెట్టినప్పుడు 2 సరిపోద్దామా? అదే చూద్దాం, నేను ఆయన వస్తాడు కదా, వచ్చాక మాట్లాడతాను. అదే అదే అలా అదే గ్రూప్ ఒకటి పెట్టానా, గ్రూప్లో అలా. See, somebody has gone to the bank and he is collapsing here. So like that, suddenly people will collapse outside the hospital. Cardiac arrest we are talking. And here also no resuscitation was done. And this is our president. He also collapsed like that, and no, this one was done.
The same thing happened to Ramanujan, a genius in Ramanujan mathematics genius, and nobody recognized. Only Professor Hardy, Cambridge, recognized his mathematics, and today number theory brought out. And at that time, based on Purti,
Rakesh.
Namaswaya Mugaya says that an Indian brain requires an acknowledgement from a foreign.
Hello. No, nothing. I just wanted to end the program. Okay, sir. So this is how a cardiac arrest occurs and people succumb to. So we have to teach not only the paramedics and we have to teach our own relatives, we have our family members and everybody in the family and your neighbors, everybody we have to teach. Then only we can save the people. So every citizen a lifesaver is our slogan. We have to we have to save them. And another thing is what we have to do is we have to take care of the AED also. AED I have shown you in the foreign countries, wherever there is a place like a mall or a cinema hall and everywhere, they are available everywhere. But in India, we do not have AEDs at any place. So what we have to do is we have to now request the government to make it compulsory to keep AEDs in the flats or the apartments. So that we have to make. So those are the things. Definitely we can save the many patients. About 4,280 people per 1 lakh population per year. Definitely we can reduce half the deaths if all of us learn CPR. So that is most important. And because all of you are medics, you are working in the hospital, these cardiac arrests can occur even on the bed in the hospital. So for these things, you will be knowing whether this patient is going to get a heart attack or not. When you think that there may be some problem, you can make the crash cart ready near the patient and you can get the AED or the defibrillator ready to give them the shock and everything. And you can also make the drugs ready for the, so then only you can save the patients. So this is part of the basic cardiopulmonary life support. Actually, we have another program that is comprehensive cardiopulmonary life support. That is what we have to do when the cardiac arrest occurs in the ward. How we have to give the drugs, what are the different rhythms of heart and all those things that we'll teach. For this, it is enough. Thank you. Thank you very much.
Thank you, sir.
Thank you so much, sir. Thank you all the participants.
Thank you, sir. Thank you, ma'am.
Thank you. Bye.
Thank you all for joining. Thank you all. Thank you.